When is a repeat ANA test necessary for lupus? A repeat anti-nuclear antibody test for lupus is generally not needed unless there are specific reasons to do so. The initial ANA test is often used as a screening tool when doctors suspect lupus based on symptoms like joint pain, skin rashes, or fatigue. If the ANA test is positive, it supports the possibility of lupus but does not confirm it alone. In most cases, once a person is diagnosed with lupus, doctors do not routinely order repeat ANA tests to monitor the disease. This is because ANA levels can fluctuate and may remain just positive even when symptoms improve or worsen. Therefore, the ANA test is not a reliable marker for tracking disease activity or response to treatment. However, there are situations where a repeat ANA test might be useful. For example, if a person initially tested negative but still has symptoms strongly suggestive of lupus, a doctor might order another ANA test after some time. This is because ANA levels can sometimes become positive later in the disease course. Also, if a person with lupus develops new symptoms or complications, a healthcare provider might order additional or repeat testing to help clarify the diagnosis or rule out other conditions. It is important to note that ANA tests are just one part of the diagnostic process. Doctors also consider other blood tests, such as anti-double-stranded DNA or anti-Smith antibodies, along with clinical examination and medical history. The decision to repeat an ANA test depends on individual circumstances and clinical judgment. Always consult with a healthcare professional for personalized advice. They can determine whether a repeat ANA test is appropriate based on your specific symptoms and medical history. Remember, no single test can definitively diagnose or monitor lupus on its own. Proper management involves a comprehensive approach guided by your healthcare team.